Last Tuesday, President Barack Obama was beaming after signing the $938 billion healthcare overhaul, which guarantees coverage for nearly 32 million uninsured Americans. This will touch the lives of nearly every citizen in the United States. Many of the law's most drastic changes will not take effect for years. Obama has emphasized the most immediate impact, such as young adults up to the age of 26 can remain on their parents' health care plans, and ban on insurance companies denying coverage to sick children. I got a chance to interview with Dr. Larry Schweikert, a professor at the University of Dayton. He has written over a dozen books, been published in the Wall Street Journal, has been a political correspondent on Fox and Friends, Glenn Beck, and Rush Limbaugh's radio show. How will we pay for this?
You know, how are we going to pay for any of this? We have a $12 trillion debt right now, and it's escalating out of control. I just read a piece today that showed that Social Security has fallen way under its income based on its outgo, and this was way ahead of schedule. Well, we could have told you that was going to happen, right? So how are they going to pay for any of this? Ultimately, it must be paid for by much, much, much higher taxes on you, because I'll be able to shelter my income, but young people are going to get hammered in this. He's probably trying to ride on Roosevelt's coattails with, in the Great Depression, Roosevelt passed the Social Security, which was a very narrow program aimed only really at widows. I mean, the main thing was if a husband dies and a woman back then didn't work, how do we support her, okay? It's since ballooned completely out of control. When it was started, there were 14 people paying into Social Security for every one person taking out. Today, there are 3 paying in for every 1 taking out. By the time you try to claim it, there will be 1 paying in for every 3 of you taking out. So that's what he's trying to do, is to build some momentum. But even today, poll after poll shows the American people don't want this. They don't like it. They want to get rid of it.
Is there anything you would like to add that the University of Dayton students should know?
There's 2 areas especially where students need to pay attention. One is that the student loan program is now going to be tied in to fund this, and they're going to start really hammering students to pay back student loans earlier and with higher interest, because they're going to need the money. Second thing is, like everybody else, students are going to find that their health care access is increasingly denied. That when you said, I really feel sick, I need to go see somebody, sorry, it's a wait of 2 months, come back in 2 months and we'll be able to see you. Well, by then you're either dead or well.
This is Carissa Rossi reporting for Flyer Spotlight News.